Hello and welcome to this edition of Ask the Doctor. Today's question came from a person asking in the response to a video we did on treating opiate dependency about codependency. And this was the spouse of a person whose child was addicted. And the spouse thought that the wife was codependent. So after a lengthy conversation, I had to agree. So I figured, that is something I haven't talked about. So let's do a video on that subject. What is codependency? Now, people who are close to individuals who are suffering from addiction want to go out of their way to do everything they possibly can to help them. But there comes a point when eliminating the person's suffering becomes an addiction in and of itself. And a lot of times when it's codependency, and I'll do another talk in the future on a related subject, but codependency has to do with one person being obsessed with controlling another person's behavior. Now, let's talk about this a minute. When you feel like this person, and you know in your heart of hearts they have an addiction problem, addicted to alcohol, addicted to opiates, or some people, this same concept applies when there's other mental illnesses or physical ailments even. But the person who's the caretaker actually sometimes ends up being the patient. And they feel responsible for this other person. They feel like they're forced to solve this other person's problems. And sometimes this person needs to have, as they talk in the industry, a little bit of tough love. And sometimes being there for them all the time and not allowing them to experience the consequences of their action actually constitutes what the experts call enabling. But that's another subject for another day. But it's not a clear line of demarcation between codependency and enabling. Okay, so we'll get back to enabling on another day. But if you feel compelled to solve somebody else's problems and they're not yours, that could be codependency. If you blame yourself for somebody else's problems, that could be a codependency. If you aren't able to accept compliments for things that you do that are positive and you reject praise, that could be a manifestation of the personality type that's prone to codependency. So what are the consequences of codependency? The real issue is it causes a lot of crippling anxiety and distress for all parties concerned. Okay, the person who starts out the caretaker can end up being the drug addict. The person who starts out treating someone or caring for someone with a opiate dependent or other drug problem, they'll end up being a benzodiazepine or an alcohol dependent person themselves. But it's not just psychological consequences that we worry about with this codependency. Physical consequences can actually occur. Ulcers, high blood pressure, headaches. I've seen even chronic and or acute exacerbations of asthma. Lots of other physical ailments can result from the stress and anxiety that results initially from codependency. So therefore, and even the DSM people who do the coding for all the insurance companies agree that the codependency can be in and of itself a disease. And the other evidence that makes it so is the fact that it can become habitual. Because people can do things out of habit even when they realize it's the wrong thing to do, when they're trying to control somebody else's behavior, someone who actually causes that person to experience greater consequences from their addiction or whatever malady. So a lot of times we not only have to deal with the patient who's being cared for, but the caretaker who's codependent might have at least as much in the way of serious issues that need to be addressed. So I'm grateful to my patient who brought this to my attention, and I'll be more sensitive to this in interactions with patients down the road, but moreover, we'll do ongoing talks and videos on these related mental health subjects, and I'll probably recruit some expertise that we're bringing in-house now to address these issues with a little more expertise than I can provide. Thank you for your question, and I welcome you to contact us at info@wisemedicalcenter.com, and we'll be happy to address any subjects that you bring up. Thank you.
Thank you for listening to the Wise Medical Minute with Dr. Thomas Locke. Dr. Locke addresses current events as well as important medical issues using responsible, unbiased journalism approached from a medical perspective. We invite you to submit questions or comments or suggestions for future topics by email to info@wisemedicalcenter.com. Again, thank you for viewing the Wise Medical Minute.